Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a health system with 2 academic medical centers. Our academic medical center status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. I'm your host, Dr. Tony Flowers, Corporate Chief Opportunity and Social Responsibility Officer. May is National Stroke Awareness Month, and today we are joined by Corporate Vice President of the Neurosciences Service Line, Alyana Samai, to discuss our hospital stroke centers. Thank you, Allie, for joining us. We're so glad to have you today. Will you tell us a little bit about yourself and your role at LCMC Health?
Sure. So I'm, as you mentioned, the Corporate Vice President for the Service Line for Neuroscience. And my role in stroke care actually began before I even joined LCMC. My training is as an epidemiologist. So I went to school for epidemiology and how to learn the different diseases and the etiology of those things. And I worked in a true epidemiologist role for several months and realized that that's not for me. I realized that I'm meant to work with people and I'm meant to see the outcome of the research and see the outcome of the numbers. And so I found out that West Jefferson Medical Center was hiring a stroke coordinator, and I applied for the role and kind of took a leap that I might not be the perfect fit, but just take a chance on me, and they did. And that was almost 10 years ago now. Wow. And so I've been in the stroke world in some form or fashion since then, and gradually have become, more well-versed in the other areas of neuroscience, your spine care, brain tumor, those kinds of things. Yeah. Neuroscience is definitely my passion. It's my love. I think it's the most interesting part of the body for sure. The brain and the spinal cord, we don't know what we don't know, and we're learning every day. And so that makes it really exciting and different every day, and really rewarding for patients when we, make those new advancements.
Well, we're so glad you're here.
Thank you. I'm happy to be here.
Yeah, it's a pleasure. And on our last episode, Kristen and Rob talked about all of our service lines throughout the system, but they also hinted at some highlights that are happening with Neurosciences service line across the system. Can you tell us about some of those highlights?
Yeah, absolutely. So as you mentioned, May is Stroke Awareness Month, and we're really proud that all of the adult hospitals in our system are Joint Commission certified stroke centers. And so what that means is that they are held to a higher standard. They are required to meet different requirements that are laid out by the Joint Commission that are best practice guidelines that really make sure that no matter what facility you walk into within LCMC Health, you're going to get top-notch stroke care. And that matters, right? Because time is brain. So we know that during a stroke, you lose 2 million brain cells every minute. So time matters, and it matters that you're getting that expert level care everywhere you go. Yeah. And so that's something we really pride ourselves on within LCMC is that there's that same standard across the board, and you're going to get amazing care and hopefully have an amazing outcome no matter where you end up. And, each facility has their own unique highlights, but, by and large, they are all living up to that same extraordinary care that we aim to provide here.
That's amazing because it doesn't matter where you're at in the greater New Orleans area, there's an LCMC Health hospital that has a stroke center. Correct. Functioning at the highest level of quality and patient safety.
Yeah, and that's a very unique layout, really. Yeah. That really is a testament to LCMC's commitment to stroke care. It is, the leading cause of long-term disability in the United States. And so just having that level of commitment from the administration and from our leadership to say, stroke care matters, and it matters that we are elevating our facilities to really take care of our community.
That's awesome. So are you seeing any trends? Is there anything specific that's happening at any of the hospitals that you want to talk to us about?
Yeah, all of our facilities are unique in their own way. They all have their own unique community that they cater to. Just to give you some examples, East Jefferson is a CARF accredited stroke center, and they have been for some time. They've been recognized by CareChecks as one of the top 10% in stroke care in the United States. And so they have a lot of really unique, great things going on. They were recently certified as a comprehensive stroke center by the Joint Commission, which is the highest level of certification that you can achieve. And so really just fantastic things happening there. To give you another example, University Medical Center is our level 1 trauma center. And we know that there are big facility that it has a huge catchment zone within the Orleans Parish area.
Yes.
And they've recently added additional services that they are endovascular capable and can provide that really advanced stroke care to the patients in that local downtown community.
Yeah.
They have a huge patient population, and so really making sure that they can do both. They can take care of those traumas, and they can also take care of the stroke patients. No matter what comes in their door, they're able to really give them that high-level care.
That's wonderful.
It is. And just thinking through, other facilities that we have, West Jefferson Medical Center, again, CARF accredited. They're a comprehensive stroke center as well. And there's a unique part of that, right? Because you talk about Orleans Parish, and we kind of joke and say that the Mississippi River is the Great Wall of China, right? Like,
Yes.
People in our community, that's a reality, right? And so it's important for us to make sure that the Mississippi River, patients feel comfortable getting the care that they need, even on the other side of the river. There's a high concentration of resources on the East Bank. There is. That's just a reality.
Yes.
And so West Jeff is really committed to making sure that the West Bank has that really top-notch care and that they aren't losing time by having to cross the bridge and seek that stroke care. Lakeview Hospital is one of our only facilities on the North Shore, and there's a huge area of need out there. They provide excellent care. They are also a primary stroke center certified by the Joint Commission, and they have been awarded a 5-star rating for stroke care. And so, they have that really expert level that they can provide even across the lake. And then New Orleans East Hospital, we talk about New Orleans East and just in general, the amazing work that New Orleans East is doing.
Yes.
Having not had care in the New Orleans East area for 10 years after Katrina, and then LCMC Health brought it back, and then really quickly after that, they became a certified primary stroke center.
Yes.
And again, just showing the commitment that they have, knowing that community needed that expert level stroke care, knowing that, as Dr. Davis says, they're kind of an island in a city, right? And so really making sure that they aren't losing time by having to figure out how to get to the local hub, but making sure that stroke care is right there in their community is super critical. They also have a really amazing outreach program. It's called the Spirit Event. It's a huge community outreach where they teach people about stroke awareness and prevention, and really just educating to really elevate the health literacy of the community. Because, that's a need, right? And it's not just in New Orleans, it's everywhere, but certainly escalated in New Orleans.
Yes.
And we want to make sure that our community understands their risk factors and understands that stroke is not something they need to be afraid of, but it's something they need to be aware of. Manage your risk factors. You can control your risk of stroke. You can reduce it by 80% by just controlling your risk factors. So
80%.
80%.
That is
so if you
amazing.
just go to the doctor regularly and you're able to know what those risk factors are, that's the education that we're providing to the community to say, look, we don't have to be scared of stroke. We can do something about it.
Yeah.
So, and then, Toro is another one of our facilities that has been very long-standing in our community. They have a long legacy of taking care of our patients. And again, they are a primary stroke center, and they are recognized by Get With the Guidelines with the American Heart Association for the work that they do in stroke. They have a massive rehabilitation center that everyone knows. They're CARF accredited in stroke. They do incredible work there. They have research that's going on there that's really unique and innovative to really enhance not only the beginning part of that stroke care, so that acute phase when we're saying, okay, let's try and reverse the effects of the stroke, but also, hey, we've got deficits now. What do we do about it? How do we really optimize quality of life after that patient has experienced their stroke? So really exciting things going on all across the system. Everyone's got their own unique thing, but it's really, really nice to see.
Well, this is so important as we look at the social determinants of health and we look at our patient population so that they really understand we've got everything that they need. At LCMC Health, we are also working to create a culture of wellness. So I'm just going to ask you, what are some things you do to contribute to your wellness?
So I exercise a lot. I actually recently, about 2 years ago, started running, and it was something I could never do before. And I woke up one morning and I said, you know what? I don't like that I can't run. And so we just started working towards that. And I did a 5K, and I was like, well, I need a little more. And so then I did a 10K, and then I said, well, I think I could do a half marathon. And I just completed my first half marathon in February. So
That is fabulous. Congratulations.
Thank you so much. Thank you.
Oh, that's important for us to know, how we are working to make sure that we are living the work that we do.
Absolutely.
Yeah. Thank you so much for joining us today, allowing us to learn more about the Neuroscience service line here at LCMC Health. Join us as we go beyond extraordinary on the fourth Tuesday of every month.